All right, and welcome. So let's go over the National Registry Advanced EMT program, kind of what we're going to be doing as an orientation to start, some of our instructors that we're going to be having here, other guest instructors as well. Like I said, one of them is currently online now with us, and she'll be doing all of your practical sessions. And we'll be discussing this here in a second. All right, so my name is Kevin. For some of you that don't know me, I've been involved in EMS for almost 25 years. I got my EMT license in 99, kind of worked my way up. I'm a critical care paramedic. I currently work full-time in South Carolina. So I'm teaching from in the warm weather down here today, hit about 70 degrees. So all my lectures will be done down here. I do pop into New Hampshire quite often, going back and forth, but my full-time job is down here, the director of operations for a pretty large service for a county. So that's kind of what I do down here. JT Harmon is my kind of like my right-hand man. He kind of handles a lot of the IT stuff. He might be in and out of the practical sessions. I may have him teach a class here and there, but he's a National Registered Advanced EMT, also an instructor coordinator as well. And he is the director of operations for Action Ambulance out of New Hampshire in the Ospey Valley in North Conway area. Zach Evans, he's a director of operations in the Orangeburg contract where I currently work as well. He's a critical care paramedic, flight medic. Spent a lot of time working in flight in Alaska and other parts of the states. And he's also a national registered paramedic. I'll skip Laurel because she's on right now and she can talk about herself for a minute. Jeff Hensley, it should be Hensley. He's a critical care medic. He's also a community paramedic. He also works down in the South as well. He's also an instructor coordinator. He's been around for quite some time, so he'd be a good wealth of knowledge. He's going to be teaching a couple of classes throughout the program. You might see some other guest instructors that might want to pop in, some other paramedics and critical paramedics that want to do some teaching, and they have more expertise in certain topics, so they may jump in as well. All right, Laurel, I know that you're here still. If you want to just kind of introduce yourself really quick.
Hi, I'm not going to turn on my camera because I'm feeding the baby, but my name's Laurel. I have been a medic for a little over 2 years now, up here in the Ospey Tamworth area. I've worked primarily 911, but occasionally transfers as well. My area for instruction that I'm a little bit better at is definitely the in-person, so I'm glad that that's what I ended up being in charge of for this class. I don't thrive as much in the online portal version of teaching. You can probably tell right now that I just like awkwardly ramble instead of teaching well. But I'm looking forward to doing some in-person classes. I probably will bring the baby, so if you guys are interested in doing some pediatric assessment, things like that, she should be 2 to 6 months, depending on when in the class it is. So that'll be a fun thing, I think, to be able to do pediatric assessments on an actual pediatric patient. I'm in the GroupMe chat thing, so if you guys have questions for instructors as well, I know I at least in there, I believe the other people are as well. So I'm looking forward to getting to know everybody that I don't know already.
Perfect. Thank you, Laurel. All right, and as you can see up here, the email addresses for Zach, myself, and JT are up here as well. All right, so now it's time for you guys to introduce yourselves. We're going to start with Jen.
Hi, my name is Jennifer Berkmos. I am with the Newfield Rescue Squad. I've been there for almost 3 years now. I'm also a park manager for the state of Maine, and I'm up at Grafton Notch. So if you're ever up in that way, find me.
Sorry about that. I was muted. How long have you been doing EMS for?
This is my second year. So
Perfect.
I'm about a year and a half.
All right, so I'm going to stop you guys for a minute. Zach just jumped on. Hi, Zach.
Hello.
So Zach is one of the other instructors you'll probably see more of than as far as the online stuff goes. So Zach, I kind of introduced you a little bit, but I'll have more than happy to let you talk about yourself for a few minutes.
Hey guys, how's everybody doing? Let's see, this is fun. I leave you muted. That way I can test you to see if you'll unmute to say hi to me. My name's Zach. I'm currently an operation manager for a private ambulance service, but I have a pretty significant background in flight EMS. I worked the last 2 years as a flight paramedic, one in rural Alaska up in the Arctic, and then also here in the low country of South Carolina. I'm also, just like Kevin, University of Florida critical care paramedic. My number is 306, so I've had mine just a tad longer than Kevin, so I like to remind him that my number is only 3 digits long. But other than that, I'm super excited to be a part of this. I'm new to teaching, but I enjoy kind of taking outside experiences and kind of bringing those to life within the class itself. So I typically will, not the type of person who reads off a PowerPoint. We'll read it and then talk about some real life scenarios and go from there. As far as actually being there to help do anything, I am way too far away to help you guys with skills. However, at any point, if you have questions about the class or EMS in general, or what you want to do in the future, I've done anything from industrial EMS to flight to more on the management side now. So if you have questions and want to ask those, feel free to message me or email me anytime. I don't know exactly which portions I'll be teaching, but you'll see me pop in and out every now and then, and Kevin and I will get to that a little further on. Kevin, anything else you want me to talk about or say?
I mean, that's pretty good.
So, all right, guys. Well, I'm looking forward to spending time with you all, and this should be a really fun class. And Kevin does a really good job of making sure you guys know. One of the things that Kevin, I'm sure he's already said, is we're not here to teach you to just be an advanced EMT. We're here to teach you to be a provider that can think on your own. We don't make cookbook medicine. We want you to be able to understand the whys behind the things we do. And that's one of the things that Kevin and I are really passionate about.
And like Zach said, that's changing you to becoming a clinician versus a technician. And that's kind of what we want to push you to. My EMT classes now are the same way. We've made that transition over. So let's see. I haven't seen Lucas jump on yet. He'll be on here in a moment. All right, let's move forward to Sean.
So my name is Sean Perkins. I'm with Waterboro Fire. I've been with Waterboro for 13 years. Been licensed EMT for coming up on 2 years. So, and I'm an IT manager in my outside full-time job.
And Sean's one of my former EMT students. All right, Mike.
My name is Mike McNiven. Currently, I'm with North Star Ambulance Service with Maine Health. I've been doing this for roughly 16, 17 years now, coming up from greater Boston area.
All right, Cannon.
My name's Cannon Barnaby. I'm with Linwood Ambulance in Lincoln and Woodstock, and I've been doing EMS for about 1.5 years.
That's the other side of the Kangamangas Highway, right?
Yes.
Yep. All right. Austin.
My name's Austin. I work for 2 911 services in rural Washington County, Maine. For you guys who don't know where that is, as far east as you can go in the U.S., that's me. I've been doing EMS for about 2 years now. I did my class when I was 16 in high school. Got licensed when I just turned 17, and now I'm 19 in college, going to the University of New England, trying to get my DL.
Excellent. All right, and I think we have Owen.
My name's Owen. I'm with Newfield Rescue, and I also work in Limerick Fire EMS, and then occasionally Naples. And I have about 2 years with the EMS side.
Perfect. And Owen, I just accepted your invite or your request for the group me.
Okay, thank you.
I think Zach's the only one that I don't know if he's in it yet or not. He might be.
I'm working on it. I'm being lazy.
No worries. You've been busy enough for the last couple of days, for months. All right. So another thing too, I like being serious about a lot of things that we do, but this is also fun. So we need to have fun while we're doing this class. Um, this is going to be kind of like your second family. You're going to see a lot of us every single week, and you have a lot of clinical time in the hospitals and ambulance services for ride time as well. All right. So as far as facilities go, I was going to have Lucas kind of go over Madison Fire. So the class location for practicals has changed from the Action Ambulance Base to Madison Fire Rescue. Literally, it's like 5 minutes down the road. So there's really no big difference as far as where you're going to be for the class for the practical evolutions. There were some changes at the Action facility where they're moving to a different location as far as the training center goes. So I had to find a different location to do the practical sessions. So when Lucas jumps on, I'll have him kind of go over the facilities with you guys and where things are located. All right, so company website, I will go over that at the very end of this lecture for the orientation. I'll kind of go over how the website works. With that, as far as paperwork goes, so clinical paperwork, run reports, ride time forms, everything you need for your FTO shifts and everything else that you guys are going to be doing is all going to be held on the firetechtraining.com portal. All right, so, and I'll go over that again. I'll go over that with you guys and how that looks when we get to that point. All lectures are recorded. Like I said before, they're all going to be put up on the portal within 48 to 72 hours after completion of the class. You guys will go back in and rewatch again. A lot of information. I'm sure you're going to miss some things. Go back, listen to it again, and look at your PowerPoint presentations, look at all your different notes. And the cool thing about this, you guys also have audiobooks. So you have a chance to listen to it in your vehicle if you want to as well. So this is new for the Jones and Bartlett for the advanced EMT or the audiobooks. It was really originally it was only for the EMT level. The password to your portal, and I'll show you how to get to it, is listed here on the screen. It's FTT AEMT. Oh, sorry about that. Let me go back. That was weird. Let's try that again. So FTT AEMT 2024. So that right there is going to be your access code to get in. It's a members only type site. So nobody else has access to that other than you guys. And I leave it up and running for you for years to come. So if you want to go back in there and look at the videos again before you take a test, you're more than welcome to do so. As far as instructors go, I'm the lead instructor. I'm also the Fire Instructor 3 certified pro board, which allows me to be an IC for the state of New Hampshire. Our fire tech training medical director is Dr. Scott Orr. He's a medical doctor as well. So he's our medical control for my program. Our clinical sites are Action Ambulance Service out of the New Hampshire division, Berlin EMS, which is up in Berlin, New Hampshire. So Action has the Ospey Valley with the 6 towns, and they also have North Conway as well. And Red Soda that still exists, and then also East Conway as of currently. And they also we do all the interfacility transport stuff out of Memorial Hospital. So there is some high call volume that's there. And keep in mind, it is winter, right? This is a summer class, be a little different. Berlin EMS is actually pretty busy. They're shorter transports, more inner city stuff like that up there versus Action Ambulance, which has more rural EMS, so longer transports to the hospital. We also use Stewart's Ambulance. Stewart's Ambulance Service out of the Lakes region only. We do not use the Seacoast as of right now. And again, when you guys tell me which sites you want to ride at, I'll put you in contact for you to schedule your time with those specific people. We still have Raymond Ambulance Service. We haven't had many people go out that far, and I don't think any of you live close enough to go to Raymond. It's kind of a drive. It's almost towards Manchester, New Hampshire. Littleton Fire Rescue. They're a pretty busy system up there in Littleton. It's about maybe an hour north of North Conway. And then we also have Huggins Hospital and Littleton Hospital Memorial. I'm still trying to finalize the contract now that they've had some changes up there in the management team. So we do have contracts currently with Huggins Hospital and Littleton. If you choose to go to Huggins, you have to let me know early because you have to go through their orientation process, which takes some time. Littleton, they take you right in. So when we get to the point of clinicals, when I release you guys out to the wild, let me know which sites you want to go to. But if you want to choose Huggins, let me know early. Because like I said, they have to get you into an orientation process, which I believe is either 1 or 2 days. As far as textbooks go, everybody here should be current in CPR. You have to make sure you have a CPR card valid by the time you take your tests. If not, let me know. I'll put you in touch with JT Harmon. He can do a CPR class for you guys. We're going to be using the AOS Navigate 2 Premier Edition platform at AOS, which is the code that I gave you. And also the AOS Sick and Injured 4th Edition. There is a ebook that is there. Was out of the class because they can see you on camera. They can see you. Yes, they can. She doesn't believe that you guys can see her. See, you're right there. They're all saying hi to you. You can wave back. All right. I did. All right. So as far as the prerequisites go, high school diploma GED is required. The ICS 100 and 700 and AWR 160. For those of you that already have New Hampshire licensure and have taken a class in New Hampshire, you already have these classes done, but it's required for the EMT. If you took a Maine class, you may not have the AWR 160, but I know ICS is required in Maine as well. All right. The AWR 160 can be found at this website. It says teex.com. You can log into there, type in the AWR 160 here. It's the HAZWOPER class. If you're good at taking tests and you understand hazmat a little bit, you can take the pre-test. You pass it, you pass the class. If not, then you have to go through the entire thing. All right. You have to have a current NREMT certification. And now again, if you are Maine license only, you are accepted into this if you don't hold a national. I did check with the state of New Hampshire. They said that it is allowed. As far as the grading goes, exams are worth 40% of your grade. Case studies are 20%. Quizzes are 30%, and attendance and participation are worth 10%. Right. So exams are scored pretty high. Right. You have to maintain an 80% or better to stay in the program. With that being said, quizzes, you have one shot at a quiz, but they're open book. Hint, hint, you shouldn't fail your quizzes. All right. So if you don't know an answer, you're going to look it up and you're going to know it afterwards. Exams are closed book. They are timed. Now, again, I can't track you guys if you're looking at your books or not, but you are timed. You've run out of time. Every question after that is answered as a wrong answer. All right. So keep that kind of stuff in mind. I put down case studies and I should have updated this. The case studies are going to be AOS assignments, and those are going to be your assessment and actions. And I will show you guys what those are later on. So case studies is being changed to assessment and action. I just never updated this presentation. I do apologize for that. Now, if you are hovering around a 77, 78%, does that mean I'm going to fail you out of the class? Absolutely not. All right. You have chances of making it better. But if you're hitting around 40 or 50% by midterm, the chances of coming back from that are pretty slim. So you have to study, right? This is a college level type class. So it's college level material. So make sure you're really putting a lot of time and effort into studying this stuff. We are not going to hit every single point of every single chapter in the book. It would take us a year and a half to do that. I'm going to hit the high points. We're going to elaborate more on a lot of the high points and what we think you need to know to become great clinicians, but you still have to read your books. All right. Health forms. All health forms must be completed and submitted to the clinical coordinator, which is myself, no later than 30 days after the start of the class. Failure to do so could result in dismissal from the course, because I need to get you guys ready to go for clinical rotations, and you have to have your health forms completed. Those are all emailed out to you, and they're also found in the SharePoint portal. They're also going to be found on the Fire Tech training portal. All right, so there's different locations you're going to be able to access this. Evaluations are required by every preceptor that you have. So every ride shift, every hospital shift, there's a evaluation form that has to be filled and signed off. That shows me that you attended that day. All right, and we'll go into how the assessments work and how you're going to log those here in a moment. Quizzes will be given on a regular basis, right? I'm doing one quiz a week. Quizzes open Thursday night at 10 o'clock at night, and they will close the following Thursday by 6 p.m. I'm giving you 7 days to take a quiz, all right? Not just one day to take it. 7 days they will be open. You get one attempt, and they're open book. Exams will be open for 5 days, and they'll be published on the calendar on the Jones and Bartley. You'll be able to see them when they're published, right? They're open for that 5-day period of time, then they close. I do not reopen exams and quizzes. I give you plenty of time. Now, if you're laid up in a hospital and you are out sick and you can't do something for 2 weeks with COVID and you're barely moving, then you have to let me know by email that you're deathly sick and you can't take an exam. All right. But 5 days for an exam, 7 days for a quiz is plenty of time for you to get this stuff done. Practical exams are done on a pass fail. Okay. There's no percentage. It's 100%. You have to pass it with 100% accuracy by the end of the program. And we're going to cover this here in a second. You need to participate. And if I notice that you're not talking with me and I see you doing something on camera that you shouldn't be doing, I am going to pick on you and ask you more questions. All right. But I want to make sure you're paying attention. This is very, very, very important. All right. To make sure you get through this. The advanced EMT test is very challenging. I want to make sure you guys pass it on the first shot through. So please, please pay attention. The final practical exam will be held at the end of April. It'll be on a Saturday. And you're going to have, I should have changed it since there's more than 6. I apologize as I didn't update this from EMT to A. All right. All the practical examination sheets for the advanced EMT are on the portal. You have to pass each one of those twice with 100% accuracy. Now, if you don't pass them both 100%, does that mean that you fail? No, it does not. What it means is you have to keep taking it till you get it 100%. Every student that I've had that have passed my exams, or let me rephrase that have passed my practical exams with 100% accuracy twice, and then have taken the practical National Registry practical examination, have passed it on the first time through. All right, so we put a lot of pressure on you guys to get through this, but you also learn a lot. You have 10 Saturday classes. All right, 9 total. The last one is going to be for the practical examination. So you have 9 total days at 8 hours a day at the max to get this stuff done. And Laurel is a phenomenal practical instructor. You guys will learn a lot from her. All right. She's a pretty solid paramedic, so you guys will learn a lot. Clinical requirements. There is a lot here, but it's not as much as you think it would actually be. You have 150 hours of clinical internship you have to complete, 75 in the hospital, 75 on the ambulance. You must have a daily contact form signed by your preceptor with all assessments and skills documented, then enter them into your folder in the portal, and I will show you your folders. As far as skills go, you have to have 15 medication administrations, whether it be intravenous, intramuscular, interosseous, intranasal. You can only use a saline drip twice, okay? You have to find other meds to be able to administer. Oxygen does not count as a medication for administration for this class. You may use medications within the advanced EMT scope of practice with the exception of oxygen for that. And again, saline. So you could give ringers, and that's perfectly fine. But saline can only be used twice. Oxygen cannot be counted. You have to have 30 successful intravenous access points, which means you have to do 30 successful IVs. You have to have 20 ventilations, whether it be via BVM with a mask, a BVM with an SGA, which is a supraglottic airway. So Kings and iGels are the two that are more common. Or BVM with an endotracheal tube if a paramedic intubates, or you're doing a transfer of some sort, and you have to ventilate a patient that way. Normally they're on a ventilator anyways, but if not, so you can utilize those as well. If you do not have the full 20, it can be challenging to get. Towards the end of the practical days on Saturdays, Laurel can test you out on ventilations. They can be done by a mannequin through simulation. And the same thing with IVs as well. But I really want you guys to get the IV time in the hospital. You have to acquire yourself 10, 12 leads, not interpret. That's not within the scope of practice of the advanced EMT. It's not one of the 6 rhythms that you're going to learn. But you have to be able to acquire 10, 12 leads. As far as patient contacts go, you have to have 10 chest pains, 10 respiratory, 10 altered mental status. You have to have 10 pediatric assessments, and that goes from newborn to 17 years old. You have to have 10 adult assessments, 18 years to 64 years old. You have to have 10 geriatric assessments, 65 and above. And then you have to have 15 team leads. Team leads are when you are in charge of the call, when you run it. You make the decisions. Now, obviously, your FTO is not going to let you fail, but you're the one making the call. I want to give this medication. I want to give this IV. I want to do this IV here. I want to, whatever you want to do. I want to do a 12 lead, 4 lead. That is up to you. It's your call to run. That's a team lead, right? When you're in charge of the run. Any questions so far? All right. Silence is good. There are no questions. All right. Moving forward. All right. Clinical prerequisites. The proof of the COVID vaccine with booster, right? Huggins Hospital requires it. The last time I checked, Littleton Hospital requires it, but if you have a reason why you can't get it, I can sign an attestation that you can't get it, and I can send it to them, and they'll waive the COVID vaccine with booster. You have to have completed health form. The next one you have to purchase, okay? And trust me, you're going to want this. Proof of liability insurance through your fire EMS service, or you may be purchasing malpractice insurance through HPSO. It's about $40 as a student for your time that you're being a student. I would highly recommend, you guys are already EMTs, you should already have this. It protects you with like a $3 million umbrella. So you should have this for yourself anyways if you're practicing medicine. All right. And I also need to obtain a criminal background check because the services as an advanced EMT, you're working on paramedic units where they have narcotics and controlled substances. So there are services that require a criminal background check. All right. So please email me those directly. Okay. As far as proof of liability, you just need to show me your receipt that you paid for it. So again, you can buy the student version, but I would highly recommend, since you're already licensed providers, that you buy the full version. And I want to say it's like $130 a year. It's not much money for something that if you screw up on a call and you get sued, you're protected for $3 million. So I'd highly recommend it. As far as attendance goes, 2 unexcused absences based on state license, based on the state, you're to be removed from the course. I'll show you where your class absence form is going to be located. Again, you have to fill these out. Right? We don't like people that like to log in late to classes, and it can be a distraction. Not so much more with the virtual stuff, but more towards the practical sessions as Laurel's starting to get going and starts teaching. Right. Trying to see if you logged in yet. All right. There we go. All right. Fire tech training does not discriminate. Everybody gets treated the same. As far as dress code goes, we'll go over, so a polo shirt, EMS pants, black closed-toed non-mesh shoes or boots are required for all clinical sites. Please do not wear mesh or Crocs with holes or Crocs in general. You're going to be dealing with trauma calls and medical calls and patients vomiting all over. The last thing you want to get that is for your mesh shoe into your toes and your socks. All right, so please make sure you're protected. T-shirts, shorts, jeans. I say shorts for summertime classes. Closed-toed shoes are for all practical sessions with Laurel. Please do not wear sandals for those. I know it's going to be winter, so I probably won't be wearing those anyways. But again, Make sure that you're dressing appropriately because you're going to be doing kneeling on the ground, standing, lifting, moving. You're playing with a lot of sharp objects like IV catheters and things like that, so protect yourself. All right, so because this is a hybrid online lecture, I have to make the mention of this. All right, every student has to have their webcam on. I have to be able to see you. The students will respond via online chat box every 10 minutes. Again, you guys will be picked on throughout class anyways, but there is a chat group or chat box you can utilize through Microsoft Teams if you feel like asking questions. All right, I have the right to call on any student in the program and ask questions based on the current lecture to make sure you're paying attention. Right, so please make sure you're paying attention. If I notice you're not, I may ask you a pretty hard question. So if, we also have sometimes have a secondary instructor to moderate to make sure things are being done right. Right. If for some reason your camera is not working and I do not hear from you, I'm going to try it again. If I still don't hear from you, I'm going to mark you absent for the class, unexcused at that point. So you have to communicate. If you are at work and you get a call and you have to leave, that's okay. I understand that. We all have jobs. We all have to do things. Just shoot me a text or send a group in the group chat box or on GroupMe. Hey, have a call. I'll catch up with you guys later. But I have to know what's going on. You have to communicate. All right. As far as student handbook acknowledgement, I believe I sent you guys those already. They're an online form, so please make sure you get those submitted to me. Sent through an email. Course outline. We'll go over that here shortly. I also had you guys. Zach will take care of it on the break. And then I also sent you guys a link for the waiver of liability as well. So please make sure you get those filled out. As far as a roster goes, with you signing into this, it attaches a roster and it makes a roster for me through Microsoft Teams. I will send or give Laurel a care package with all the rosters, blank ones that she'll have for you guys to sign in and out the days you have practicals. So she'll have those on a clipboard for you guys to sign in and out. And yes, you have to sign out the time that you leave. Right. So I want to make sure you guys are staying for the entire class. All right. Medical evaluations again, 30 days. Make sure you get those in. Rotations, very important. All right. I normally assign you guys where you need to go. You're from all over the place. So let me know which one is closer for you, and I'll assign you to those days or to those sites. All right. Any clinical question that has to, for clinical rotations, not clinical care, has to go through me. All clinical hours must be completed at the end of the program to pass the program. I have to have 150 hours documented time or more. If you want to do more, that's perfectly fine. Without the hours or contacts, you cannot sit for the class final. Okay. You have to have everything completed with all your hours to sit for your class final exam. Right. I don't normally give extensions. Now, obviously, there are certain circumstances where things happen, and it's on a case-by-case basis. I will be checking in with your clinical preceptor, your FTOs, and your preceptors. Right, everybody that you're going to be riding with, I know people that work there and who you're going to be riding with, so I will be checking in with them periodically to find out how you are doing, and so make sure that you're actually in appropriate clinical attire. If you sign up for a shift and you are unable to attend the shift, you have to contact the clinical site letting you know that you're not going to be there. No call, no shows will not be accepted because there are times, remember, there are other programs that are trying to ride at the same time. So we want to make sure that people are getting a fair chance of getting in. And if my students keep calling out of their clinical shifts, they can pull my clinical site contracts. So please make sure that you are showing up on time. And on time is 15 minutes early. So if you have a shift starting at 7, please do not get there at 7 o'clock because they might be going out on a run. 15 minutes early. All right. 15 minutes early is on time. Half an hour is early. All right. Uniforms. Make sure you guys are wearing your uniforms on your rotations. As far as Facebook goes, I Facebook stalk a lot. I don't think Zach does much on Facebook, but I do a lot of it. So we will be looking, and again, I am friends with a lot of people from the areas you guys are working in. So I see a lot of things that go on, and people know who I am. What I mean by that is we are bound under HIPAA laws. So if you post a picture of a patient, a motor vehicle accident, anything while you are on clinical time, you are out of the program. Okay, I cannot keep you on. Now, if you're on a volunteer fire department or a fire department, you want to take a picture of the scene, you're not doing clinical rotations, that is up to you. But when you're on my clinical time at my clinical sites, phones put away, no posts on Facebook. You can utilize your phone for clinical references and different apps you might be able to utilize, but please do not post anything that will violate HIPAA. Now, if you want to say, I'm at my first clinical rotation site, that's okay. It's when you start getting into patient care stuff and things like that. Remember, we got to keep things private. As far as cell phones go, you guys are all adults. If you're unmuted, please make sure that your phone is on vibrate. Mine stay on because of work and I have to be able to answer certain calls. So, but other than that, please make sure your phones are silent throughout the class or vibrate. And during clinical rotations, please do not answer your phone. Put it on vibrate. If you have to step out for an emergency, let your preceptor know, hey, I had to step out of the hospital for a minute. I got an emergency at home. Right? That's perfectly fine. Group B is something that I said is brand new. I believe everybody is now into it, other than Lucas is not and Zach is not, but I'm going to set Zach up here shortly. So all of you should have gotten an invite. All right. Any questions before I get into the website stuff? Everybody good? Everybody's still there? I don't have the cameras up right now. I'm trying to swap things around. Yeah, there's cameras again. All right. Let's see. All right, let me go into the portal stuff really quick. Good.
Okay, put it down.
Well, you're unmuted so I can hear you. Thank you. All right. So I can't see your cameras right at the moment. Can everybody see the screen okay? Feel free to unmute.
You're good.
Fine.
You're good.
Awesome.
Yep.
All right. So let's go to all right. So this is the company website. So this website here I developed with the portals for you guys to be able to do all your clinical rotation assessments. So you're going to highlight over portals, go down until you see the Fire Tech Training Advanced EMT Program Winter 2024. You're going to open that up. Go down to password. Type in the password. FTTAEMT 2024. Enter that in. This will get into your site. So in here is your student manual. All you have to do is click on it and your student manual will pop up. All right. In your student manual lists instructors, course hours, the class dates, which we'll go over the syllabus here in a moment, your clinical sites, medical director, the location of the practical sessions, which will be here, 1917 Village Road in Madison, New Hampshire. And basically everything else we already went through. So my apologies on the presentation. Exams are worth 50%, 30% for quizzes, 10% for assignments, and 10% for attendance and participation. So your exams are worth quite a bit. It's half your grade. Now, I do offer an extra credit as well, which will add an additional 5 points to your final grade. And the extra credit is not listed in here. But if you choose to do so, the extra credit will be on an EMS topic, whether it be some last class, my EMT class, someone did something on Kawasaki's disease for an EMT class. They had to present it over 10 minutes with a presentation, whether they use PowerPoint or whatever, but they had to submit a 5-page. My goodness, I can't even think today. They had to submit a 5-page document in regards to utilizing what resources that you had, references, using APA format, and they submit that to me for review. And they have to present that topic to the class at the end of the class. That'll give you an additional 5 extra points to your final grade. So if you're sitting around a 76, 77, you're going to pass the class with above an 80. I give you the extra 5 points to your final grade with that assignment. It's up to you if you'd like to do that or not.
And let me add, if you all need help, if that's something you want to do, feel free to reach out to me for ideas or support with that as well.
Perfect. Thanks, Zach. And one of the things that I like to mention to everybody is pick a topic that you're not comfortable with, because that might brush you up on some stuff as well and make it better for you. All right, so quizzes, practical exams, everything else we just went through is all here in your student manual, along with all the required hours and skills. All right. Let me go to the next one here. All right, the syllabus. This is the course syllabus here. It's been updated with the new site location. So in theory, tonight, you should have already had read chapters 1 and 2. You're all EMTs, chapters 1 and 2 from the EMT text to the advanced EMT text. All it does is change the name of EMT to advanced EMT. There's nothing difference between those two at all. So you should be fine. In your AOS platform, you'll see something called soft skills. You have to do the soft skills and then all the assessment and actions. I'll show you where to find that. The dates are listed here, the time frame and hours per section. Now, is this set in stone? Absolutely not. There may be topics where I go over because I think you guys need to know more about it. That's perfectly fine. What may happen is let's say on a Tuesday, let's say I'm very passionate about EMS systems and we kind of go over. In the next class, we may finish up one of the other sections and go to the other 2 chapters. It might be a little bit shorter. Right? We try to get everything done within that week. Right? Your first sectional exam is January 23rd. It's coming right up. Right? So you guys have a lot of chapters to go over, and we start our first sectional exam, which will be opening up on the 23rd. I'll show you guys how that works for that time frame. Airway management. Your first practical day is February 3rd. Excuse me. And in that day, Laura will also go over, excuse me, the cyanide kit, advanced spinal, lidocaine for interosseous access, duodenum administration, practical sessions will be followed by that. Again, this is all going to be where she's going to discuss this during your time that's there. There's no presentations as they're kind of going over it. Right? So you'll see different practical sessions are all listed. Sectional 2 is February 8th. Sectional 3 is March 5th. Sectional 4 is March 21st. And then we keep moving into your end. The final is like sectional 5, but the final covers everything from the beginning of class to the end, all 42 chapters. That'll be April 18th, and April 20th will be your final day. Hi, Lucas. How are you? All right. Let's go to the next section here. The National Registry of EMT skill sheets for the advanced. I'm sure they're all here. Okay, they are. These are all the different ones we have to go through for the advanced level. Bleeding control, shock management, cardiac arrest, AED management. That may come out. I have to just double check with them, but the New Hampshire has pulled the AED CPR one out of it because you get CPR through your class. So let me just double check with that one there. Interosseous bolus, or sorry, intravenous bolus medications. Intravenous therapy. You're going to have a random BLS station, so we're going to test you on all of them. joint immobilization, long bone immobilization. You're gonna have a patient assessment medical, patient assessment trauma, pediatric interosseous infusion, utilizing the EZIO drill, pediatric respiratory compromise, supraglottic airway device, and you'll have a King and an iGel present for you to use. And that will be it. So there's 11 stations you're going to have to go over that Laura will be setting up and become proficient. If I were you, and this is my advice to you guys now, make this part of your study session now. Start looking at it and memorizing what's on there. The best thing to do for these skill stations are memorizing them. Most of the skills you already know, other than IV therapy and drug administration, but review bleeding and shock management, review long bone, splinting, the ones that you haven't touched in years, right? Because that's what normally fails people on the practical assessments or exams are the random BLS. This right here is the class absence form. If you are not going to be able to attend class, go to the portal and fill out this form here. Very simple, to the point, hit submit. Right? That way there, I get notified you're not going to make class. Do not fill it out after the class is over before you go. If you're working, get forced in. I just need to know you're not going to be at class. Make sure you fill that out. The AEMT clinical evaluation form. You need to print these out, circle either ED or ambulance, and have your preceptor complete this form, and they have to sign it as the evaluator. If you do not turn these in, I'm repeating this again, if you do not turn these into me, your clinical day does not count. Right? That's why it's so important to make sure you get those filled out after every clinical rotation. That goes for hospital and ambulance. At the bottom of the site here, you'll find links for recorded class lectures. So orientation, chapter 1, chapter 2. And I separate them so that's not all in one continuous presentation. Right? So you'll have all those there, and they'll be posted up within 48 to 72 hours. Now comes your clinical skills form. By the way, my site is also mobile friendly. So you can log in from your phone and do your assessments. So I'm going to use Lucas since he's the first one on here. If you have a day that you are on the ambulance, that is a field site, field skill. If you're in the hospital, that is a hospital skill. When you submit your assessment in action, which I will show you guys how that works, that goes here under assessment and action submission. Each one of these are individualized per provider, so I can track what you are doing. For a field skill, click on the field skill. It'll bring you to the first page. Your name will be up here and what it is used for. Do not put anything in here that will violate HIPAA. Please do not, okay? So I have to submit this stuff to the state per request. You're going to put in the date. Right? How many hours you were at the clinical shift for, right? So if you were there for 12 hours, put down 12 hours. Which clinical site for ride time you were working at. So I'll put down Action EMS. Hit next. Intravenous access. This is done per patient contact for field skill, not for the entire shift. For every patient contact you have, this has to go in. Successful, unsuccessful, or not completed. You may have BLS calls. It happens. No IV. IOs, not completed. Let me update that. It should have said intramuscular. That will be updated to intramuscular access. So not completed. Intranasal access, not completed. Right? What medication you administered. These are all the advanced EMT medications. You can select more than one on the call. So if you gave all these different meds, you can select those. At the very bottom, you can click other. Right? You really shouldn't be filling in other. Right? I do not want to see you guys put down fentanyl, Dilaudid, Versed, morphine, Valium, any of the medications that are carried in New Hampshire. Please do not put those down. You are not a paramedic. You cannot administer a narcotic or a controlled substance. All right. Ventilations, which type you utilize? BVM with mask, ET tube, and a 12 lead, yes or no. Then you're going to hit next. Chief complaint, cardiac, respiratory, mental status, or any other one you may have had, right? Could have abdominal pain, whatever, put that in the bottom. These are what the National Registry require. These are anything additional. Now, you could have chest pain with abdomen pain. You could do this. Okay? And it logs both. You could have a patient with chest pain and respiratory distress. And that counts as 1 and 1. You get 2 out of that. Patient age group. Select one of the following. Were you team lead? Yes or no. Hit next. Signs and symptoms go in here. Allergies, all the patient medications, right? And then your patient care narrative goes here. So whatever you do for a narrative, soapier, drat, D-chart, story format, whatever you utilize, that's where that goes. When you're done, hit submit, and then that will submit your call. But basically, it's like a run report. All right. For the hospital skills, this is a little bit easier. There's no narratives. Click on hospital skills, put in your date, hours you were at the hospital for the shift. If you do a 16-hour shift, that's fine. Which hospital location you were at. I will add Memorial in if you get everything situated with them. But you do Huggins or Littleton, hit next. Number of successful IVs. You may do 20 IVs in one day, but you also may have missed 10. IOs. I'm going to get through all this here. Intramuscular access, intranasal access, any medications that you administered. So if you gave someone Zofran, you got to type in Zofran, right? And it also wants a dosage and how you gave it. So 4 milligrams, we give that IV. Next, you gave aspirin. You can abbreviate if you want. Aspirin. I gave 324 milligrams. I gave that PO. All right. I gave LR 1,000 milliliters IV. Number of successful ventilations. You ventilated anybody? How many you did? So you got a code in ER. 1. How many 12 leads you completed? 12 for the shift. Hit next. I think I missed one somewhere. Over here. And it'll actually tell you if you missed anything. And then the last part here before you submit, chief complaints, list them all. So if you had a chest pain, without a chest pain, shortness of breath, so that I can track what's there. Number of patient assessments based on age groups. Then hit submit. So there's no narratives. It's for your entire shift. So please make sure you are taking notes. Very important. All right, you don't want to miss any of your clinical stuff. All right, your assessment in action. Click here. Choose the chapter you're submitting. So for you guys for tonight, by next week, you should have chapters 1 and 2 done. So you're doing chapter 1, the date, and then your answer will go here, and then your answers go here. Usually there's 10 questions you got to answer on them as part of your assessment in action for the chapter. I recommend typing out in Word, Note, whatever you want to use, and copy and paste it in, hit submit. All right, so that's it with the portal here. Any questions to this point? We all good? Someone has to unmute. I can't see you guys right now. All right, I'm seeing thumbs up. All right, let's put my cameras back. Perfect. All right, the next one is JB Learning. All right. Lucas, I have to give you a code to get in. Stand by. All right, your code for JB Learning is 3296-9443. Want me to text it to you? Let me just copy that real quick. I just sent you a text with the code. All right.
Kevin, were you talking to me?
No, I'm talking to Lucas. I just sent him a text with the code for that. So what you're going to do is you're going to go to my account. If you don't already have an account, you need to create one, right? You're going to log in. Right. Lucas, here's the other part you need to know too. The course ID when you log in to create your account with that code is 33FCD8. You're going to have that to create the course ID. That way there puts you into my class. Right? You're going to select the class that you're taking. Right? You're going to launch the class. And this is what you guys will see as part of your portal. If you click on dashboard, it will show you the class days. Your quizzes will also be in here too as kind of a calendar for you. And I believe you can import your calendars to your Apple calendars, Google, whatever, if you want to do it that way. So once I start posting quizzes and get everything set up, everything will be posted in this calendar here for you. My course here. Right. Your grades, you'll have a tab that should say grades on there. So right now, out of everybody, only 3 people have signed up for the class so far. So you gotta make sure you log in with those codes. Your grades will be posted in here. You guys will not see these interactive lectures. You'll see the soft skills simulation. And then at the very end of it, you'll have your quizzes, exams, AOS assignments, your attendance, and then your totals will be here. Your class grade. All right, let's get into the actual course itself. Quizzes will be inside this folder here. Exams will be in here. You guys will not have attendance. I'll keep track of attendance myself. Test prep. It's going to become your friend. In test prep, you have the ability, so you're not going to have this when you say view as a student, it'll pop in like this, right? You can take practice exams or take a complete assessment, which is like the National Registry exam. So with that being said, if you have a test, I was kind of messing around with it a little bit here. So you'll have a question. So a 50-year-old man found unresponsive in his garden. Your assessment reveals meiosis, hypersalivation, fine muscle tremors to the face. What would you suspect for a type of issue? I know that it's going to be a pesticide, looking at toxidromes, right? Looking at our toxidrome, looking at dumbbells, sludge. That's going to be a pesticide or an organophosphate. So it'll be green if the answer is right. It'll show red if the answer is wrong. And it gives you some feedback at the bottom. So I'm just going to pick one. Oh, I got it right. I didn't read the question. Hold on. I want to do something wrong here. Appendicitis. No, seriously? I got 3 right in a row and I didn't read the question here. There we go. So it marks it red, shows you the right answer, gives you some feedback below it. Once you feel like you've mastered that question, you can change your settings. And then you may not see that question again. Right? The people that have utilized test prep in my classes have passed the registry exams. Please utilize test prep. Right? You guys paid for it. Might as well use the resources that are there for you. All right. Now let's get into the chapters. Here's your soft skill simulation. Click on here, log into it, and complete it. That's all you have to do for soft skills. It's one program. Let's get into chapter 1. Now, virtual mentor lecture series, virtual ride along videos. They're pretty cool to watch. If you want to watch them, you can. I am not going to grade you on these. They're optional. Okay. Now get into your chapters. Here's chapter 1. Learning objectives. Here's your ebook. Right? So you start reading your chapters through your phone, whatever. Interactive lectures, flashcards. Here's your audiobook. Your slides, your lecture outlines, case studies, and the very bottom, assessment and action. Right? So when you are at the end of every chapter, I do the case studies anyways, but the assessment and action you guys have to complete. You saw that login on the fire tech training portal, right? Yes? Okay. You're going to log into here. Right? It's going to bring it up in Microsoft Word. Hold on a minute. Still opening. Oh, there we go. So a call comes into 911 center for a child who is not breathing. The caller and the mother breathe through the thing here. You have to get your answers. So answer your questions. What I would do, honestly, and other students have done before, is they take this and they delete the wrong answers with the right answer up there, copy and paste the entire thing, so you have to type it all out again, and paste it into the assessment action, hit submit. It'll make your life 10 times easier, no more typing. So if you think 911 is the correct answer, you can go in here and just delete those, then I'll know that's your answer. If you don't want to do it that way, just go here, if that's right, and just put it in, okay? That's the answer I want to choose, it's in red. So these have to be completed after every lecture, okay? Now, do I check them every week? No. They have to be done by the end of class. So if you got a long week at work, a lot of things going on, vacation plan or whatever, do them the next week. Just make sure all 42 chapters are done. It's an all or nothing, right? That's 10% of your grade. So if you're hovering around at 85%, and I take off 10% of that, you're gonna fail. You're failing at that point, right? So make sure you get these done. I don't want to see it. Any questions with Jones and Bartlett? Right? Clear as mud, right? Yeah. There's a lot to it. Ask questions. Talk to Zach, talk to Laurel, talk to me, right? Let us know what's going on. I give a lot of leeway because there's a lot here. Work with me, I'll work with you, we'll get it through it. All right. So Lucas, you're the only person that didn't introduce themselves.
I'm Lucas. Madison Fire, Action Ambulance, EMT, Ski Patrol. Known Kevin for quite some time, but yeah.
Yep.
So
we finally got a class going.
Right. Yeah. You guys will be. I think we're still doing stuff here at the department.
Yes.
Yeah.
So I was going over like, bathroom locations, things like that, and I wanted you to kind of go over it. It's been a little while since I've been in Madison Fire, so.
Yeah. No problem with that. I mean, we're still kind of decorated for Christmas right now. We'll get that cleaned up though. But no, plenty of room, plenty of bathrooms. Got two, 3 bathrooms to. Yeah, so there shouldn't be any problem there. We got a kitchen, so feel free to bring lunch or whatever you do, microwave, stove, oven, you name it.
So my last EMT class did potlucks every single time. Every class they had, they brought a potluck, they brought something in.
Yeah.
And they basically had one heck of a feast.
Yeah.
I missed a lot of that, so I was pretty bummed out. But so if not, you have Community Market not too far up the road. They have pretty decent food there.
Yeah,
There's some other ones in the area.
Yeah, we do not have takeout places in any reasonable driving. Your 15-20 minute drive just to get to well, we got Subway down the street. It's probably the closest.
Do you have West Ospey or North Conway or Conway? about it.
Yeah, right. Yeah. So I would come prepared. You're not going to run out and just go grab something, unless it's up at the pizza place. So
Yeah, normally we give it about an hour for lunch. So,
Yeah.
like I recommend, if you guys want to do something with potluck, bring food.
Yeah.
That's the best way to do it, and it helps build team camaraderie too. All right. So why don't we? If anybody else has any other questions, Zach, are you good? You might still be there. All right. Let's take 10 minutes. Actually, let's come back. Yeah, let's come back at 7:25. And we'll start with chapter 1.